Hello everyone, I'm Phil Diamond, the spokesperson at the U.S. Embassy Kampala. I'm here today with Professor Rhoda Wanyenze, the Dean of the Makerere University School of Public Health. Welcome, Professor.
Thank you.
Thank you for hosting us today. We're here to talk a little bit about what the professor does here at the School of Public Health, a little bit about the work of the School of Public Health, how they're contributing to the COVID-19 response effort, how the partnership between the U.S. government and the Makerere University School of Public Health is helping healthcare in Uganda. And so with that, I'll launch into the first question. Professor, could you tell us a little bit about the Makerere University School of Public Health and how many students do you have here?
Makerere University School of Public Health started as a Department of Preventive Medicine about 66 years ago, as a department within the Faculty of Medicine then, and we grew into the first Institute of Public Health in Sub-Saharan Africa in 1974. So we are actually the oldest teaching institution in public health in Sub-Saharan Africa. And we have grown from one academic program when we started many years ago to now 9 public health programs. 8 of those are master's programs, and then we also train in PhD level. Most of our programs include disease control, which is really the core of public health, and that includes both infectious diseases like COVID as well as the broader epidemiology. Yeah.
Great. And what is your specific role here at the school?
So as the Dean of the school, my role is largely administrative, to facilitate the core functions of the school. The teaching, the research that we do, as well as service. We do also implement several projects where we provide direct services and technical support to the Ministry of Health, and sometimes support the districts as well. So I do support those programs administratively, and we also have quite a number of projects that we implement in this school, including those with funding from the U.S. government, predominantly CDC, but we also have some projects funded by USAID. So my role is to make sure that those programs are effectively implemented and we are accountable as well. But in addition to that, I also do some teaching, and then I also do research as a professor in disease control.
So you mentioned some of the partnerships with the United States. Could you tell us a little bit more, some of the current and past U.S. government partnerships that have been very helpful to developing the School of Public Health?
We have had very long-standing partnerships with the U.S. government. The oldest is the partnership to train in public health. The first program, our flagship program as we refer to it, which we started about 25 years ago, the full-time Master of Public Health, was started in partnership with the CDC, Ministry of Health. We also had support from the Rockefeller Foundation, the World Health Organization, and other partners. And right from inception, CDC provided technical assistance. The first technical advisor to this program, Dr. Mark White, was posted by the CDC, and Dr. Larry Maram, who came after that to replace him. So we've had a very long-standing partnership with CDC in particular. And from the Master of Public Health program, we've actually trained most of the people that are managing health programs in this country, right from the Ministry of Health to the district services. And last year, when we celebrated 25 years of that program, we did a tracking study of about 700 people that had gone through that program. And 89% of these are actually working here in Uganda. So we've had a very good retention with that program. And half of those are working in the Ministry of Health, in the districts, or they are within academia. And that includes people like me that are contributing significantly to the public health arena within Uganda. So that has been a very significant contributor to public health within Uganda as well as the region. We've also had a fellowship program that we implemented in partnership with CDC for 14 years. That program was largely focusing on leadership, starting with leadership of HIV programs, a 2-year fellowship that trained more than 100 people, and many of them are also very senior people in this country. Some of them are working with you at CDC, like Dr. Stella Alamo. I was also among the first fellows on that program. So we've trained many people in leadership. Then we, in that same program, we also developed programs to support quality improvement and monitoring and evaluation. And we trained more than 400 people in a 9-month hands-on program. That includes many people, again, at the Ministry of Health, as well as districts, including district health officers. So that was a very successful program where we also developed short courses and trained thousands of people through short courses, in addition to the fellowships, where we supported more than 500 fellows overall. So that was a very significant program, which was then eventually adjusted to become the current Public Health Fellowship Program. I hope you know about the Public Health Fellowship Program. It's about 4.5 years, getting to 5 years towards the end of this year, focusing on field epidemiology to enhance the capacity for Uganda to be able to detect and respond to epidemics such as COVID very quickly. So that has also made a significant contribution. When we look at our records so far, we've graduated 40 people from the Public Health Fellowship Program, and we have 25 in the pipeline. And their program, when we train them, is really a hands-on program where you're learning as you do. And it was modeled after the Epidemic Intelligence Service program in the US, also same with the Master of Public Health program. So they learn as they do, and we expect each of them to lead at least one investigation, one outbreak investigation, whether it's cholera, whether it's yellow fever, anthrax. We've had many of these over the past 5 years. In fact, when I checked our records, we've had them either lead or participate in more than 200 outbreaks. Now that might sound scary because it's just 5 years, but Uganda happens to learn, to be located within a region that's very prone to outbreaks because of our proximity to the rainforests, the Congo Basin, which has a lot of pathogens and very prone to outbreaks. So we've had the fellows contribute to investigating more than 200 of these over the past 5 years, which is a big contribution in terms of improving the capacity to detect and respond to epidemics and also to arrest them very quickly. So many of these never make it to the papers, to the media, because they are arrested very quickly and they don't blow up to become a huge problem for the country. So that's one of the programs that has been also a very useful. But currently we have 2 cooperative agreements also with CDC, that particular program supporting workforce development, and then we also have one for monitoring and evaluation technical assistance to the Ministry of Health and the districts. And then we also have USAID support to implement the Resilient Africa program, which is a partnership that started by supporting several universities across Africa. There should have been about 16 universities, but we also have the One Health program that is funded by USAID, Washington, and is again a network supporting several universities within Africa. That is also a program that is targeting disease response within the region. Yeah.
Now, you mentioned being personally a fellow on the Public Health Fellowship program, or is it a different
so
program?
Yes, it started as a leadership program. So I was a fellow on the leadership program in the second cohort of that program many years ago.
Could you tell us a little bit about that experience and how it was for you?
It was a great experience, very different from the master's training program, which were largely didactic. Our master's programs in this school, we tend to have hands-on experiential learning, and I was also a student on the MPH program. But the fellowship was fully out in the field. You're learning to be a leader, you're learning by doing. So the program is really a good one, where you have mentors, senior people supporting you and helping to fast track your progress to become a leader. So I believe it made a very big difference for me in terms of the growth of my leadership capabilities. And immediately I came off that program, I was actually managing a fairly large program which was funded by CDC, coincidentally, as well. Yeah.
Lots of attention right now, of course, on COVID-19 in Uganda and around the world. Curious if you could talk a little bit about COVID-19, anything that the School of Public Health may be doing to help with the response, and anything specifically that the current students may be doing to help with the response here in Uganda.
COVID is a big problem. It's a big problem for the whole world, and it requires to bring to the table all the expertise from academia, from the field. The Ministry of Health has pulled together many partners, and Makerere University is one of the key players in that. We have several colleagues from the School of Public Health in particular that are participating at various levels of the COVID response. I'm participating in the scientific advisory group to the minister, to the ministry myself, and we have another colleague who is also a graduate of these programs, Professor Sengova, who is also part of the same group. But we also have other colleagues participating in other scientific groups that are doing research. The ongoing community survey, we have Professor Noah Chiwanuka among other professors, Jolova within the college. So we have many people that are participating at various levels. We have the fellows from the Public Health Fellowship Program, and more than 20 of them have already been deployed within the districts where we have to do a lot of work for the contact tracing. They are right now in Masindi, we have some in Rakai. And they've also been involved right from the onset. They were participating in the screening at the airport. So we have a lot of them participating. Then we have 34 of our recent graduates from the Master of Public Health program that have also been part of this response right from the onset, supporting the screening at the airport, the quarantine, and following through various processes in terms of contact tracing for the travelers that we were trying to reach out to. At some point we had many of them participating in that as well. So we have had a lot of people contributing to this response, from the advisory right up to the frontline people that are doing the tracking and doing the investigation to help improve the response. We are also doing a lot of research, following through research. COVID is a new disease with a lot of unanswered questions, a lot of gaps in evidence. So we are part of the teams that are working to address the gaps in evidence within Uganda, but we are also working with partners, other partner universities within Africa, to respond to questions collaboratively. And before we wrap up, any other final messages you would like to share with the public and anything we haven't covered today? To the public, I would say that defeating COVID is going to require an effort and contribution from each and every one of us. Everyone has a role to play. Individuals out there need to protect themselves to make sure that they don't acquire COVID. They need to stick to the prevention measures, the social distancing, hand washing. We need to wear masks like the president said. We need to do whatever we can as individuals to protect ourselves, protect our families. And if it turns out that you are infected, make sure that you don't transmit COVID to others, again, by following the procedures for prevention. Everybody has a role to play. This is not just about the Ministry of Health, it's not just about the President, it's all of us collectively.
Great, thank you so much, Professor, for joining us today, and keep up the great work.
Thank you.